Hey, Dr. Dennis. I have a few questions for you. My tooth hurts. How soon can I come into the office? And what will you do when I come in?
Sounds like you have a dental emergency. Now, what is a dental emergency? A dental emergency means that something has cracked or broken or something started hurting that didn't quite hurt the day before. So, a dental emergency can be classified in a lot of different ways. Your face could be swollen, you just feel like something's sweet and it hurts. So, no matter what the reason is, you definitely want to get it checked out if it's come to the point that you have symptoms. Now, we like to see you as soon as possible. I always make it a priority in our office to see emergencies the same day. Now, depending on what your needs are, we sometimes can start treatment that same day, but if we cannot, sometimes we'll give you some medications to hold you over. But as soon as possible is always the way you want to go. If you wait too long, you can sometimes have abscess as infections that form that will make it more difficult when we do treatment.
Sometimes I'm not sure where the pain is coming from. Can you tell?
Having referred pain is very common. A lot of times when you have pain, let's say on a bottom tooth, it will start to radiate everywhere. Oftentimes I'll hear people say they have pain to their ear. Sometimes they say they have pain up to their eye. It can go in a lot of different places. A lot of times someone will touch a tooth and they'll say, ooh, maybe it's not that, it's that. Or maybe it's not that, maybe it's the top. And that's just because the pain starts to just all the nerves are connected and everything starts to kind of run together. It's so important for you to address that as soon as possible, because if you start to feel pain everywhere, that means it's getting much, much worse. When you come into the office and we take an x-ray, we are able to see most of the time where that pain is coming from. But symptoms matter. So I like to talk to you. When did the pain begin? When do you feel it? What makes it worse? Is it when you have something hot or cold? Does it go away right away, or does it linger for a while? Is it waking you up at night? Is it going to your ear? Is it going to your head? All of those things matter. Even though I may be able to see something on an x-ray, hearing how you're feeling matters too. So all of those things we will discuss so we could decide what's the best course of action.
I have pain that's keeping me up at night. What does that mean?
Pain that keeps you up at night is a classic root canal symptom. And the reason that it's a classic root canal symptom is because, let's say, for example, we have other videos about this to kind of describe this more in detail. Let's say, for example, you have pain with sweet. You have something sweet to eat, goes away. You have a cold drink, have pain, goes away. Something hot cup of coffee, goes away. But when you have pain at night, it usually means you did nothing. You had nothing to eat, nothing to drink, and out of nowhere, the tooth starts to throb, it starts to ache, it starts to hurt. And if teeth start to hurt without any stimulus, that's what when we say stimulus, we mean that hot cup of coffee, that cold glass of water, that sweet piece of candy or chocolate. You didn't even do anything and the tooth starts to hurt. That usually starts to indicate that something is already in the nerve, affecting the nerve to the point that you don't even need anything for it to hurt. And usually that means the cavity is in the nerve and you need a root canal. Now, sometimes you get pain at night. It may be a wisdom tooth or some other tooth that's cracked and broken into the nerve and it's no longer savable. But that's also something that we can discuss together.
The tooth is cracked and broken. Can it be saved?
When a tooth breaks, it's really difficult to say whether or not it's going to be saved until we can do an exam. So what happens is you come into the office, we take an x-ray, we talk about your symptoms. I take a look inside of your mouth to see what it looks like. Sometimes the tooth will break and it just be a simple thing. Maybe your filling came out and we just need to do a new filling. Sometimes a piece of the tooth will actually completely break off, but above the gum line. Oftentimes I see that happen with silver fillings. The silver filling will stay intact and half of the tooth comes off. And in that point, you usually need a crown. Now, if that broken tooth stays for a while, the cavity can start to grow and it will grow into the nerve and you may need a root canal and a crown. Now, everything just gets worse in dentistry untreated. So if you need a root canal and crown and don't get it done, that cavity is going to keep eating at the tooth until eventually it completely destroys the whole tooth. And at that point, we're talking about an extraction. And once we're talking about an extraction that is not your wisdom tooth, usually we're talking about replacing that tooth with an implant. So you see how the whole succession, filling to crown, to root canal, to extraction, to implant. So you always want to get done as soon as you feel something, you want to get it checked out. Now, the better way to go is to go regularly so it doesn't get to the point that you feel something. And that way you can avoid a lot of dental emergencies.
What are the different things that you may have to do to get me out of pain?
Once we've established what is wrong, then we will determine what we need to get you out of pain. So depending on the severity of your pain, then we'll talk about maybe we're just doing a filling today. Or maybe we're starting your crown. Or maybe we're doing a root canal. And the root canal is going to take the nerve out. And once we take the nerve out, you're usually going to feel better really quickly. The next thing is maybe we need to pull the tooth. And if we're going to pull the tooth, again, you're going to feel better much quickly. You are going to be sore after because you had a tooth pulled, but at least you'll feel much better than before. You won't be staying up at night in pain and that sort of thing. So there's a lot of different treatments that can address your dental emergency. But once we take a look, then we can know. It takes me about 5 seconds to know, maybe I'm even over exaggerating, maybe about 1 second for me to know what you need. But then we need to sit down and talk about it. So once I've seen the x-rays, I've taken a look in your mouth, then I'll say, I already know what you need. And then once we discuss it, we can talk about options if there are any options. And then we can get started either that day or as soon as possible, whatever fits your schedule and what fits our schedule too.
Thank you, Dr. Denis.